Hi, I'm Dr. Ashish Davalbhakta at Aesthetics Medispa and Advanced Aesthetics in Pune. In today's video, we are going to cover recovery of rhinoplasty. If you are contemplating to have a rhinoplasty procedure, the first thing that people want to know is how the recovery is going to be like and what to expect. So we'll talk about what the normal post-operative course of a rhinoplasty patient is like. Now we do rhinoplasty as a day surgery. For very few select rhinoplasty procedures, we have to admit a patient overnight. But what to expect immediately after surgery? So let's say that it's going to be under a general anesthetic procedure. It's preferably under a general anesthetic procedure. So you wake up from the anesthesia, everything is done. You are a little bit sedated or groggy, and you gradually become alert and awake. We then, get you to drink after the normal nil by mouth period is over, and then we get you to mobilize, and once you are comfortable, you've been to the washroom, and all your vital parameters are all stable, we discharge you. You would be having nasal splints inside the nostril if septal work is done. The ones that we put have tubes, so it allows you to breathe through those. There are some surgeons who block the nostrils completely with a pack, which means that you would have to then breathe through your mouth. But we prefer to have these splints which have tubes that allow you to breathe through the nose, so it doesn't make it too awkward for you initially. There is a dressing placed on the nostrils to catch any bleeding or drip that happens for a couple of days. You would have a splint or a tape on top of your nose, and that's it. You may feel a little sore in your throat from the tube that you've had during the anesthesia. That settles down fairly quickly. We encourage you to drink warm fluids or hot drinks to keep your throat nicely lubricated. Try not to sleep in too dry or too cold an atmosphere like in an air-conditioned room. Try to keep the humidity levels high, because the normal nose function of maintaining the humidity and the temperature is going to go after the rhinoplasty and with the tubes in the nose. Keep yourself well hydrated and warm, and you can eat normally. Nothing too hot, nothing too spicy. Try to stay away from alcohol because of the medicines that we're giving you. They can interact with alcohol and give you gastritis. So try to avoid that for some time. We also recommend that you sleep slightly propped up, which means the back slightly elevated 20 to 30 degrees at an inclination that prevents congestion of your face and prevents the face or from swelling too much. So that's a position that we recommend that you take at home when you're sleeping. Ambulation is all perfectly fine. You can sit, you can walk, you can even watch TV. You'll be absolutely comfortable. Coming to post-operative pain, fortunately, rhinoplasty surgery is not that painful. We don't get patients complaining of pain after the surgery. There will be discomfort, there will be heaviness, but very little pain. And the painkillers that we give, that is good enough to cover the pain and make you comfortable. You have to take your antibiotics and the painkillers on time. There are some nasal drops that we give to keep the nostrils lubricated. And second post-operative day onwards, swelling starts to set in. And the swelling around the eyes can be really bothersome. Bothersome in the sense that it can even scare you sometimes. You could have a bruise. Bruise means collection of thin blood under the skin in this area, called giving rise to black eyes. If it happens, nothing to panic. It settles down in 3 weeks' time and disappears. Even the swelling around the eyes, which peaks on the third day, that starts reducing over time, and by 7 days, most of the eye swelling is gone. But the nose swelling does take time to go. We call you back for a cleanup in 2 days' time. Once the cleanup is done, then we call you back maybe alternate days or directly on the 7th post-op day for removal of the stitches and removal of the plaster or the splint, and then we clean it up. If you've had an osteotomy where your bones have been fractured and narrowed, the splint goes back on again, and the splint then stays for around 2 weeks' time. So we call you back then again in 2 weeks time, and then we take the splint off, and that's it. Then after that, then you can look after yourself. There's nothing much to do. You just have to sit tight and wait for the swelling to settle. We recommend massage. There are some various ways in which you have to massage. If you massage your nose, then it helps the swelling to abate faster. In another video, we'll probably cover the way one should massage the nose. So the post-operative course is usually uneventful in many patients. Very rarely some patients may get bleeding from the nose, and minor trickle is not unusual because you're fractured and there could be some bleeding from there that trickles down from the nose. It gets collected in the gauze that we put on the nostril, but after that it stops. And in very rarely, you could see a little more persistent bleeding, and if that happens, we would recommend that you give us a call and we can have a look at it, and then we may recommend some treatment like nasal packs or whatever to get that bleeding to stop. Apart from that, you may find that your nose is blocked. You may have to breathe through your mouth. Watering of your eyes is sometimes an issue, but apart from that, it's a fairly uneventful recovery and very smooth. If there are any other concerns, if you feel that people want to know when they can get back to work, so you could work from home from the next day if you're working from home on a laptop, or you could take 3-4 days when the swelling is maximum, rest, and then start working. If it involves going to work, then see how comfortable you are to go to work with tapes on your nose. If you feel that you will not be comfortable, then obviously you would have to take 2 weeks off and then go to work after that. When it comes to exercise, we recommend that you don't exercise while the healing is on. We don't want you to pump up your blood pressure and increase the bleeding. So 3 weeks definitely no exercise. After 3 weeks, we'll let you start maybe gentle walking or stretching, but nothing that involves with your head being dependent, so that we don't want gravity to cause congestion of your nose and increase the risk of bleeding. By 6 weeks, you can hit the gym and go back to the routine that you've had prior to surgery. So I think I've covered as much as I could think of. If there are still any more queries, do write to us. I'll be happy to answer your queries. And please click the like, share, and comment sections if you have any comments to make. And subscribe this channel if you like this video and want to see more of these. Thank you very much.